The Philippines has a very high infant and maternal mortality rate, partly because there are still high percentage of deliveries conducted in home without proper medical care. Living far up in the mountains and islands, there is a little or no access to even basic health services or primary health care. Apart from the physical barriers in providing health care, doctors, midwives, and public health nurses have to deal with cultural constraints. Traditionally, people living in the far-flung area would not take any modern medication, fearing that they would anger their leaders, their culture, and gods. This added extra burdens on the healthcare providers, particularly in the community, who trek up deep mountains to go to people to deliver services to culturally sensitive manner. This condition leads to the prevalence of maternal and child mortality in the Philippines.
Maternal and child health has been a measure of how efficient the health system of any country works.
I think, the tragedy that it's such a big scale of death, but it's not very well known.
If you die from a disease, it is understandable. You were saying pregnancy is a disease, and how come women are dying from it?
We always want the pregnancy to culminate in a healthy baby and a healthy mother, right?
As a public health nurse for 8 amazing years, I've seen the community, all the corners of it. I've learned the most effective way of managing maternal and child health program and all other programs of health. The key is good governance, and that leads me to this advocacy. My advocacy is about systems thinking. This involves the 6 building blocks of health that the health leaders should look into. The leadership and governance is the most important thing. Once it is in place, all other elements will fall into its places. Our political leaders and health leaders has the most significant role in this maternal and child healthcare strategy. Leadership and governance refers to a wide range of steering and rule-making related functions carried out by governments, decision makers as they seek to achieve national health policy objectives that are conducive to universal coverage. Leadership and governance in building a health system involved ensuring that strategic policy framework exists and combined with effective oversight, coalition building, regulation, attention to system design, and accountability. In the local levels, the local health board is composed of health leaders such as the local chief executive, the city and municipal health officers, the DOH representative, and other expanded members will adopt policy on maternal and child health program, implement it in the community as collaborative, participatory effort to achieve Sustainable Development Goal number 3, which includes the improvement of maternal and child health. The creation of maternal and child core team in every locality will keep track on the status of maternal and child health, including various challenges and finding a solution to these problems. The need for greater accountability arises from increased funding and a growing demand to demonstrate results in different localities. Accountability is therefore an intrinsic aspect of governance that concerns the management of relationships between various stakeholders in health, including individuals, households, community, firms, government, and non-government organizations that have a responsibility to finance, monitor, deliver, and use health services. The goal of leadership and governance in maternal and child health program is to establish policies that will serve as a guide and basis of actions for mentioned intervention that is aligned to the national level. By coordinating actions across different parts of healthcare system, programs to improve maternal and neonatal health can increase coverage and reduce barriers to the use of various services. Health financing is fundamental to the ability of health system to maintain and improve human welfare. At the extreme, without necessary funds, no health programs will be achieved. No health workers would be employed. no medicines would be available and no promotion or prevention would take place. However, financing is much more than a simple generation of funds. To understand the nature of indicators that can be used to monitor and evaluate health system financing, it requires explicit assessment of what it is expected to achieve. In primary healthcare facilities, birthing homes are applying for accreditation so that they will be licensed for PCB or MCP. PCB means primary care benefits and MCP means maternal care package. When the primary healthcare facilities becomes accredited, they can generate income through field health and they can pool their funds to improve the health facility and compensate their employees. The goal of health system financing seeks to raise sufficient funds for health. At the same time, it allows women and children to use needed services without the risk of severe financial hardship or the so-called financial catastrophe or impoverishment. The financial risk protection of the mothers giving birth is priority to reduce the risk of resorting to home delivery, which often result to maternal and newborn mortality. Health leaders should have a plan on how to raise funds equitably and progressively. It also needs to consider how to ensure access to needed services while protecting people against more severe financial consequences. The health workforce can be defined as all people engaged in actions whose primary intent is to enhance health. This human resource include clinical staff such as physicians, nurses, pharmacists, dentists, and midwives, as well as the management and support staff. Those who do not deliver services directly but are essential to the performance of health systems, such as the managers, the ambulance drivers, and accountants. The ability of the locality to meet its goals depends largely on the knowledge, skills, motivation, and deployment of people responsible for organizing and delivering health services. Numerous studies have evidence of the direct and positive link between the numbers of health workers and population health outcomes. Many regions, cities, municipalities, and barangays have lack of human resources needed to deliver essential health interventions in different healthcare settings for a number of reasons, including limited capacity, migration of health workers within and across the country, poor mix of skills, and demographic imbalances. The formulation of national policies and plans in pursuit of human resources for health development objectives requires sound information and evidence. Policymakers has a big role in the decision making. Currently, there is an inadequacy and lack of training of health workers to respond to healthcare needs of a given population, and the shortage of health workers can be perceived from the inadequate number and skills mix of people being trained or maldistribution of their deployment, as well as the losses caused by death, retirement, career change due to security of tenure. Not only the quantity but also the quality of health human resources that health leaders shall consider. Capability building for human health resources is important to ensure provision of quality health services for maternal and child care. Sound and reliable information is the foundation of decision-making across all health system building blocks. Accurate and reliable information system of maternal reports is essential for health system policy development and implementation, governance and regulation, health research, human resources development, health education and training, health service delivery, and health financing. The health information system provides the underpinnings for decision-making and has 4 key functions: the data generation, compilation, analysis and synthesis, and communication and its use. The Maternal and Child Health Program Health Information System collects data from health and other relevant sectors, analyzes the data, and ensures their quality, relevance, and timeliness, and converts the data into information for health-related decision-making. Without a systematic reporting of informations, there will be a gap between the reality and interventions provided. The health information system is sometimes equated with monitoring and evaluation. In addition to being essential for monitoring and evaluation, the information system also serves as broader objectives, such as providing an alert and early warning capability, supporting the patients and health facility management, enabling planning, underpinning and stimulating research, permitting health situations and trends analysis, orienting global reporting and reinforcing communication of health challenges to the diverse users. According to the World Health Organization framework for health systems, a well-functioning health system ensures equitable access to essential medical products, vaccines and technologies of assured quality, safety, efficacy, cost-effectiveness, and their scientifically sound and cost-effective use of all levels of healthcare. To achieve these objectives, the following are needed: the national policies, standards, guidelines, and regulations that support policy to be cascaded to the locality and barangay level, information and prices and status of international trade agreement, and the capacity to set and negotiate prices, the reliable manufacturing practices, the procurement of supplies and storage, the support of rational use of medicines. The local government unit and the leaders shall monitor access to essential health medicines that should be readily available for maternal and child care. Health service delivery. Strengthening service delivery is crucial to the achievement of health-related sustainable development goals for maternal and child program, which includes the delivery of interventions to reduce child mortality, maternal mortality, and burden of HIV and AIDS. Service provision or delivery as an immediate output of the inputs into the health system, such as the health workforce, procurement and supplies, and financing. Increased inputs should lead to improved service delivery and enhanced access to services. Ensuring availability of health services that meet a minimum standard and securing access are the key functions of health systems. The process of building evidence for strengthening health service delivery must proceed alongside efforts to restructure service delivery. Health sector leaders and policymakers who are tasked with assessing their health system should participate in the process of deliberate on ways to assess the key characteristics in their cities, municipalities, and barangays. Good service delivery that is culture sensitive is a vital element of any system. It is a fundamental input to population health status along with other factors, including social determinants of health. Based on this advocacy, I have modified a roadmap for MNCHN program. This is composed of 6 building blocks: the health leadership and governance, health financing, health human resource, access to medicine, health information system, and health service delivery. The health and political leaders are expected to implement or establish the criteria in each building blocks to ensure effective implementation of MNCHN health program. For health leadership and governance, there shall be an active MNCHN program committee as member of the local health board for policy development. There shall be an investment plan for MNCHN program and MNCHN community engagement activity. For health financing, there shall be a budget allocation and utilization for MNCHN program, and also field health coverage for indigent pregnant women. For health human resource, it is expected that there shall be an adequate health human resources such as doctors, nurses, and midwives. There shall be a presence of trained human health resources on MNCHN capability. And there shall be a registration and accreditation of barangay health workers assisting maternal and child care, and implementation of Magna Carta for public health workers. For access to medicine, there shall be a presence of essential primary care medicines at health centers or stock basis. For health information system, there shall be a functional health information system including registration and referral. There shall be an accurate and reliable recording and reporting system, an established system for maternal and infant death review, and also a warning system and management for pregnant women during emergencies. For health service delivery, there shall be a health service delivery that is functional. Patient-centered care, feedback mechanism is available at the health facility, functional healthcare facilities, established referral system, health promotion services, disease prevention and control services, curative services, and rehabilitative services. Systems thinking identifies where the system succeeds, where it breaks down, and what kind of integrated approaches will strengthen the overall system, and thus assist municipalities, cities, and all regions in reaching the sustainable development goals. By coordinating actions across different parts of health systems, programs to improve maternal and neonatal health can increase coverage and reduce barriers to the use of various services. Effective programs assemble packages on appropriate reforms in each of the main building blocks of health system. Governance of the health sector to provide sectoral policy and regulatory mechanism and partnership with the private sector. Infrastructures and technology to provide emergency referral centers linked to primary healthcare providers. Human resources to scale up the availability of skilled attendants. Financing to reduce financial barriers of maternal and child and incentivize providers. And services to ensure quality and an appropriate configuration of maternal and neonatal health services across all levels of care.